Dark underarms can affect anyone and is often a source of embarrassment and discomfort. One of the most frequently asked questions I get on my social media is how to treat dark underarms. So today, I'm going to talk about some of the most common causes and how you can effectively address this concern at home. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my channel. If you enjoy learning about skin hacks, skincare tips when it comes to treating common concerns, then I would love it if you can give this video a thumbs up and subscribe to my channel. So what are some of the common causes of dark underarms? First and foremost, this can be 100% normal in darker skin tones. In body areas like the body folds, where there tends to be a little more redundant skin, it is very normal for the skin to look a little bit darker in those areas compared to the rest of the body. Now, certainly this dark skin color can be exacerbated or made worse by certain factors, such as excessive melanin deposition, whether it's due to irritation, friction, sweat, shaving, as well as a condition called acanthosis nigricans. And all of these we're going to address today in this video. So let's address each of these factors one by one, starting off with friction. Friction is one of the most common causes of dark underarms. When there's constant rubbing on the skin, whether it's from tight clothing or just skin-on-skin contact, over time, this leads to darkening of the skin as well as thickening of the skin. That indirectly makes the underarm area look darker. And shaving, especially when done regularly, is also a source of not only irritation, but also friction on the underarm area. The next category is irritation, and this is very broad. I mean, literally can be irritation from, again, friction, but shaving, as I mentioned earlier. Shaving itself does remove a part of the top layer of the skin, the stratum corneum, and in a way is kind of like a physical exfoliant and certainly can damage and break down the skin barrier when it's not done properly, and thereby increases the irritation and therefore the hyperpigmentation risk. Sweat itself can be irritating. The sweat can cause burning sensation, can also again break down the skin barrier. It can also be true irritation, like a reaction to a personal care product like antiperspirant or deodorant more commonly, and this can lead to actual rash, like what we call irritant or allergic contact dermatitis, that then lead to post-inflammatory hyperpigmentation. And lastly, another common source is called acanthosis nigricans, and this is a medical condition that is essentially due to hormonal changes often associated with polycystic ovarian syndrome, insulin resistance, diabetes, and obesity that kind of manifests as a finding on the skin. Acanthosis nigricans itself is not dangerous, but is extremely challenging and difficult to treat. And often it's one of those skin conditions where it's really best prevented than treated. And once you have it, like I said, it's very, very challenging. And many times the treatment is more cosmetic and not often covered by insurance. I have a whole video dedicated to dark underarms from acanthosis nigricans, and I'd be happy to link it below for you to learn more in details. So now, knowing some of the common causes, how can we best mitigate those risk factors as well as treat if you are experiencing dark underarms? First and foremost, to start off with, friction. The easiest is if you wear a lot of tight clothing, go with looser fitting clothing, ideally made from natural fabric so they're more breathable, and stay away from synthetic material. Maintaining a healthy weight is also really important. When you have excessive weight, you're going to have more skin-on-skin friction that's going to lead to hyperpigmentation. If you're an individual who is very active and you find that the running, the exercise and the repetitive motion really induces skin-on-skin rubbing, then consider using a barrier cream or even like petrolatum or anti-chafing stick to help to protect the skin and reduce that frictional component. So for example, it's not the most comfortable, but one of the most effective is just using petrolatum. I really like this one from Vaseline. It's the all-over body balm that's 100% petrolatum or petroleum jelly. Aquaphor also has a stick as well. The sticks I just find because it's really easy to carry and also easy to apply, that requires really no application with your hand. So if you're like going to the gym and you want to have something you can easily put on, like a antiperspirant, this would be a great one to use on the go. Another product that I saw recently that came out from First Aid Beauty, I actually received one of the PR packages. I haven't tried it myself, is they actually have an anti-chafe stick, and it's their this is the sample size anti-chafe stick with shea butter and colloidal oatmeal. Great ingredients that's going to keep your skin barrier protected and supported. Something again that you can use like the Vaseline stick in body fold areas that tend to get skin on skin rubbing. I find that whether it's the petrolatum or this anti-chafe stick, you are going to get some stickiness of the skin because again, that's the whole idea behind these barrier creams. If say ointments are not your thing, consider going with just like a barrier cream. One of my favorites is just a good thick moisturizer or one that have active ingredients like Cicaplast balm from La Roche-Posay that contains B5 vitamin as well as soothing ingredients, derivatives from centella that have soothing and calming properties. And this is really nice because you can use this after showering, after shaving, but also it's so lightweight and fast absorbing, yet it really helps to coat and protect your skin. That is definitely a better alternative if you really don't like that sticky, greasy feel under your arms. Okay, now let's talk about shaving because certainly, as I mentioned, shaving can contribute to not only irritation but friction, and proper shaving techniques can certainly make a world of a difference when it comes to minimizing discoloration. Now, if you are an individual who is really sensitive, then you may want to consider other ways of removing hair in the underarms to minimize that. So, laser hair removal, even though it's out of pocket, but can be a great way. Here, I certainly do not recommend waxing because waxing is very similar to shaving where you're literally pulling off hair and skin, and that itself can be very traumatic and irritating. You can also consider chemical depilatory creams, although the risk is that potential reaction irritation. But say if you are shaving and you want to learn the proper ways of shaving, this is what you really want to do. Number one, make sure that you shave on wet skin. And ideally, if you can gently exfoliate the skin prior to shaving. And I recommend using just a gentle cleanser with maybe alpha and beta hydroxy acid to help remove some of the dead skin buildup. Two, definitely always use a lubricating shaving gel or cream. Two of my favorites are from Aveeno as well as Vanicream. They're very gentle, fragrance-free, and less likely to cause any irritation on skin. Choosing the right blade is also really important. Ideally, pick ones for sensitive skin, and also single blades are going to be less traumatic than multi-blades because single blades only goes over your skin once, where a razor with multiple blades will basically cut your skin multiple times. When you are shaving, make sure your skin is wet, apply the shaving cream or gel, and then shave in the direction of hair growth to minimize irritation. And then most importantly is the post-shave care, which is essentially applying a moisturizer to support your skin to keep your skin hydrated and healthy after shaving. And this is where, again, pick a moisturizer of choice, but my favorite, again, is just the Cicaplast balm. You can also look into something a little more pricey from Aven, the Cicaplast with zinc and copper. That's also anti-inflammatory and soothing. Those are great options. It can be as simple as petrolatum or even the anti-chafe cream with the ingredients I mentioned earlier can be very helpful in keeping your skin healthy and supported. And also, I would recommend holding off on any other skincare products if you do use anything, as well as personal care products like antiperspirants or deodorants immediately after shaving. Your skin has just basically been physically exfoliated, so it's certainly in a more delicate, vulnerable state. So wait until your skin has some time to recover. So ideally, maybe giving it overnight to repair itself, but you definitely don't want to apply anything heavily fragrance or something irritating immediately post-shave to your skin. A fragrance-free moisturizer or anti-chafe cream or petrolatum is really all you need. Next is rethink your personal care products. One of the most common causes of irritant and allergic contact dermatitis that I see in patients on the underarms is actually from deodorants. Reasons being is that deodorants often have a lot of natural ingredients, often heavily fragranced, containing essential oils or plant-derived ingredients that can actually be a common culprit of irritant and allergic contact dermatitis. Deodorants work by masking the odor. Antiperspirants work by controlling the sweat, and thereby you reduce the odor indirectly because the odor from the underarms comes from sweat and the bacteria on our skin that then digest the sweat and create the odor. So essentially with deodorants, you're just masking the odor, and because of that, it's often utilized as fragrance to mask that unpleasant smell. So really the best thing is I recommend going with a hypoallergenic antiperspirant. Now, having said that, aluminum chloride, which is the active ingredient in antiperspirants, can be irritating for some. So here I think really you have to just sometimes play around and finding the right product that works well for you. A lot of times it's trial and error, but the one that I frequently recommend and repeatedly recommend for individuals that have sensitive underarms is from the brand Vanicream. They actually have two options. One is a deodorant and one is an antiperspirant deodorant. And both of these are fragrance free, which is what I highly recommend, especially when you are prone to hyperpigmentation and trying to treat underarm hyperpigmentation. Fragrance can just be additional source of irritant that you do not want to have. Their deodorant is interesting because it does not contain fragrance. What it contains is an active ingredient called triethyl citrate, which basically, when it's applied to skin, gets broken down to lactic acid that thereby reduces the pH of the skin in this area and thereby is antimicrobial, and that is how it works. So if you find that antiperspirants with aluminum chloride irritating for your underarm, then I recommend checking out their deodorant. Otherwise, I find that for the majority of the times when I have recommended the antiperspirant, it's been well tolerated by many of my patients, and that is the one brand I really recommend going with for personal care products, especially if you have experienced irritant dermatitis from some of the common deodorants on the market. Okay, now let's talk about how to effectively treat the hyperpigmentation once you get them. So first and foremost, I want you guys to understand that this is a very slow process. Anything that works really quickly is just going to cause irritation and thereby worsen the hyperpigmentation. Underarm skin, we know at baseline, has a more defective skin barrier. What that means is it's just going to be more prone to irritation, which is one of the reasons why it darkens more readily than other parts of our body. So with that, when you're treating the hyperpigmentation and where most commonly those treatments can be irritating, you have to be extra careful, but also extra patient. Give a timeline of like 3 to 6 months, if not longer. And certainly seeing a dermatologist for in-office procedures and professional treatments may be more helpful in addition to what you're doing at home. Now, when it comes to lightening true hyperpigmentation, again, prescription treatments like tretinoin, hydroquinone is going to be the most effective, but also the most irritating. So I certainly do not recommend you trying that on your own, but rather under the guidance of a dermatologist if you are going to use that. When it comes to lightening products at home, I recommend going with more gentle formulations, which I'm going to recommend, and just giving yourself time while minimizing those risk factors as I mentioned earlier. So what are some of the products? Number one, retinol can be helpful, especially when it's formulated in a gentle way with other brightening ingredients. One of the most gentle ones I've talked about many times is from CeraVe, their resurfacing retinol, the one in that teal white bottle that contains encapsulated retinol that's gentle but yet effective, as well as a licorice root that we know have anti-inflammatory as well as brightening properties. So that's certainly something you can use on a nightly basis as tolerated. Another product I really like that I found to be very helpful for my body hyperpigmentation that is very gentle is from Paula's Choice, and it's their 5% body serum. I really like this one because this is fragrance free. It contains 5% niacinamide, so an effective yet lower concentration that is not going to be as irritating compared to like say 10 or 15 or 20%, as well as B5, vitamin B5 panthenol that's soothing. It is a creamy serum that is also hydrating, so really ideal for the underarm skin. And you can use this, twice a day to over time help to lighten up the uneven skin tone. Another product I like is actually for post-acne marks. I mean, it's meant to be used on the face, but it's super gentle that I find it to work really well in the underarm area as well, and that is from Restorative Elements, and it's their dark mark corrector. This is really nice because again, it contains brightening ingredients like niacinamide, as well as a little bit of glycolic acid, as well as licorice root. It also contains centella that's going to be soothing and anti-inflammatory. And I just really love the creamy nature of this treatment where it's going to be hydrating, it's not going to stain, it's fragrance free, alcohol free. So it's really a great one that can be utilized on a regular basis without causing significant irritation. If you're looking for a gentle exfoliant, I actually think polyhydroxy acid is really the way to go because they're gentle, they're hydrating, but also over time will tackle that hyperpigmentation. And one that is in a body moisturizer that's great for bumpy skin, but you can also multitask and use this for dark underarms is the one from Aveeno, the Tone and Texture Daily Renewing Lotion. This is fragrance free. It contains 4% gluconolactone, which is a type of polyhydroxy acid, and it can help to over time, again, remove that hyperpigmentation. And it's really gentle where you're not gonna worry about hyperpigmentation compared to like the traditional glycolic or even salicylic acid. And I do not recommend using glycolic acid toners in this area. You're going to end up really with just irritation and worsening of hyperpigmentation. So really for the underarms, go with more gentle formulations. And the key is really just using them consistently and being patient and using that over time. Now, having said that, exfoliation can be helpful at removing dead skin cells and thereby gradually remove the hyperpigmentation. Instead of going with exfoliating pads, the traditional, chemical exfoliants, treatments, I actually recommend using an exfoliating cleanser on a regular basis to more slowly over time remove the buildup of pigment. And here there are, lots of different cleansers on the market, but because cleansers, you're washing it off, it's less likely to cause irritation and they can still be effective. There are a few that are on the market. One from CeraVe, the one with salicylic acid is really nice. Otherwise, Murad has a combined BHA and AHA gel cleanser. Naturium also has a really nice creamy one that lathers really well. It's just really nice to use. That is the smoother glycolic acid exfoliating body wash that contains glycolic acid as well as 5% of other alpha hydroxy acids. So regular use of that can be helpful. The key is just avoiding any leave-on exfoliants because those tend to be way more irritating. And if you shave regularly, then you definitely want to avoid the use of physical scrubs. And in general, I do not recommend physical scrubs on the underarms. Again, it's inducing more friction and can potentially worsen the hyperpigmentation. Lastly, I just want to briefly mention acanthosis nigricans, even though I have a dedicated video, because it is one of the most common causes of dark underarms. So first and foremost, acanthosis nigricans, aside from the darkening of the underarm skin, there's actual textural change to the skin that is very different and noticeable compared to elsewhere. The skin is often what we call more velvety and even slightly more verrucous in nature. Aside from the underarms, the back of the neck, inner arms, as well as the inner thighs are other common locations for acanthosis nigricans to develop. If you notice this, I definitely recommend following up with your doctor or provider because often it's signaling there is some sort of hormonal disruption or irregularity happening. Often, as I mentioned earlier, it's polycystic ovarian syndrome or the likelihood of developing insulin resistance and diabetes. It's also important to see your provider because if those are appropriately addressed, often you can really reduce and stall the development and the worsening of acanthosis nigricans because as I mentioned earlier, it's one of the conditions where it's so challenging to treat. It's often better prevented than treated. Now, having said that, if you have mild acanthosis nigricans, one of the most effective things you can try over the counter is ammonium lactate based moisturizer. So for example, lighten, it also contains one that's 12%, which can be more irritating, but it can also be effective. And what is happening here is the exfoliation from the lactic acid helps to reduce the thickening of the acanthosis nigricans, which is essentially what it is. But it takes time and you want to be careful because it can be irritating. So you certainly don't want to have secondary hyperpigmentation from the irritation. But medically, when I do see individuals for this condition, I often will prescribe a combination of ammonium lactate based moisturizers like Lighten. Eucerin also has one. First Day Beauty also has an alpha hydroxy acid based moisturizer, which it has basically the same efficacy. I prescribe one of these moisturizers to use alongside prescription retinoids, so most commonly tretinoin. The two can be effective, but again, extremely irritating. So it's one of those things where if you are experiencing acanthosis nigricans and you want to have it treated more effectively, it's really best managed under the supervision of a dermatologist to get best results. Often we will combine this with in-office laser treatments or even chemical peels to really give you better outcome. And if you're wondering about what in-office procedures are performed, to be honest, we don't have a lot of great effective treatments. What has been shown to be helpful are different types of chemical peels, either super strong glycolic acid peels or trichloroacetic acid or TCA peels have been shown to demonstrate efficacy. Certain types of lasers may be helpful, but again, if you are individual with skin of color, those lasers can potentially cause disruption of pigment and leading to undesired discoloration. So this is where, again, you just really need to see a dermatologist or provider who is experienced in operating these devices and performing these treatments in your skin tone. All right, guys, so that's it for this video. Now, even though I mostly talked about dark underarms, very similar, pretty much exact same concept applies for other dark body folds, like commonly dark inner thighs. So let me know in the comments below whether you found this video helpful or not, and let me know if you have any questions. And if you are someone who is treating dark underarms, I would love to know what products you're using and what you find to be helpful. Again, thank you so much for watching. I'll see you guys next time. Bye.